Thames, Cross River Partnership is now delivering London's future together, with partners from local, regional and national tiers of government, businesses and the community. CRP is currently working to deliver a range of different projects. These are on your screens now. CRP would like to thank its major funders for making this LiveShare possible, central government units DEFRA and Innovate UK's Challenge Fund, as well as the Mayor of London. CRP is currently delivering a wide portfolio of projects. Our Healthy Streets Every Day project, for example, works across 17 London boroughs to allocate more street space to walking and cycling, creating a healthier place for those who live, work and visit London. And CRP's Clean Air Villages project is supporting hospitals, businesses and communities to keep London's air clean, ensuring continued support for these three key demographics as COVID restrictions are turned on and off. CRP's vision is to empower people to deliver innovative projects that support places to really thrive and survive. For more than a decade, we have ensured that clean air leads this approach. A recent survey from Global Action Plan found that 70% of Londoners want the government and local authorities to tackle air pollution and traffic more urgently than before the coronavirus outbreak. Essential to this recovery is the promotion of clean and healthy commutes, switching to low pollution deliveries, helping customers choose low pollution options, create clean air workplaces, bring cleaner air to your neighbourhoods, and to normalise flexible working. In addition to working towards a reliable health recovery from COVID, we also want to support economic resilience in ways that benefit our wider environment. It is possible to grow all three of these factors in tandem, and transport plays a pivotal role within this. Having said all of this, though, it is imperative that this growth and resilience from COVID leaves nobody behind. 2020 marks milestone anniversaries for three pieces of seminal disability rights acts: the 50th anniversary of the Chronically Sick and Disabled Act of 1970, the 25th anniversary of the Disability Discrimination Act of 1995, and the 10th anniversary of the Equality Act 2010. And although these acts brought equal rights for disabled people, there is still more that can be done. And in light of doing more, it is paramount that we use this opportunity to build back better from this pandemic, ensuring inclusivity for all within our current and future street space designs. I'd now like to welcome and invite Councillor Claire Holland, Deputy Leader of the Council for Sustainable Transport, Environment and Cleaner Air of the London Borough of Lambeth, to speak more about building inclusive and accessible streets. Over to you, Councillor Holland.
Thank you very much, Thomas. I'm absolutely delighted to be here. Thank you for inviting me. And thank you to Cross River Partnership for all the much needed and fantastic work you do. And in Lambeth, we're very proud to partner with you. So, achieving transport equity in Lambeth, how do we create inclusive and accessible streets? Well, I just want to start with why we're doing the stuff that we're doing. It's important to remind ourselves of what we're looking to achieve and why, in order that we can continue to learn and make sure that we get it right. So in Lambeth, everything that we do is underpinned by tackling inequality. The four big ambitions in our borough plan that we say are the four pillars that hold up our borough are sustainable growth, resilient communities, independence as much as can be, and place. And these big ambitions cannot be achieved without transport equity and equality on our streets. Our streets across London, across our nation, are unequal places. For example, they are not designed by or for young people, and this ends up with their exclusion, and we wonder why they don't want to engage with us. We are a young population in Lambeth, so this is fundamental to who we are as a borough. And then there is a lack of equal access for all, including parents and young children, people with mobility issues and disabilities, both physical and mental. And in Lambeth, we're a densely populated urban environment where the majority of our households live in flats, and only around 40% of our households own a car. And we know that car ownership correlates with income. And if you're female from a poorer background or black community, you're less likely to own a car. And car ownership is less in the north of our borough than in the south. And in the south of our borough, residents are heavily reliant on rail and buses. There's no tube there. And we know the significant problems there are with accessibility at railway stations, for example. And we have no east to west bus service in the south of the borough. So last year, we adopted our transport strategy, which identifies in more detail the inequalities to which I just very briefly referred. We collected data and intelligence and evidence and consulted, and we agreed our transport objectives for the borough. And we said, and I quote, "We are not prepared to accept that many members of our community, including disabled people, are excluded from the transport network because their needs are not met. We need to address all forms of exclusion, physical, social, economic and cultural, to provide a truly inclusive network. That entails promoting step-free, safe and welcoming, affordable, intuitive and convenient transport options that are responsive." So these are the values that we carried forward into our emergency transport response to COVID-19. In lockdown, we saw people using our streets differently. Leisure centres, gyms and parks were closed. And remember those majority of Lambeth residents living in flats, meaning no access to private outdoor space. Residents were out on the streets exercising, socialising, looking after their physical and mental well-being. And as lockdown eased, we anticipated, rightly in hindsight, that people who own a car may be more likely to use it to get around as they didn't feel safe mixing or were being asked not to use public transport. And we are heavily reliant upon public transport as a borough. Remember those car ownership figures I mentioned? Only 4 in 10 own a car. So the majority and our more disadvantaged residents don't have that car choice. So how could we enable and encourage, act and deliver accessible, safe, walking, cycling, scooting and wheeling routes, leaving the roads free for those that do need to drive? Otherwise, gridlock, a return to poorer air quality and increased road danger were on the way. And essential workers needed to get to work. So this was a key consideration in where we prioritised interventions. For example, the first low traffic neighbourhood we implemented was around Cycleway 5 that stretches the whole length of the borough from south to north, linking town centres and servicing Tommy's and Guy's hospitals and the centre of London. And we needed to connect town centre to enable residents to support local business and support a local economic recovery to enable people to get back to work and school safely. So what did we actually do? Well, we had to focus on schemes that could be delivered at speed and simply, quick and transformational. We have in 5 months delivered 5 temporary low traffic neighbourhoods, 4 healthy routes and over 20 school streets and other smaller measures. Now, usually we would consult and engage and go out to the community for lengthy periods of time. Indeed, the charge tone at local authorities is often we talk but don't deliver. But in COVID, in this pandemic, in times unknown and not experienced, we had to move quickly and effectively. All our transport funding had been stopped, and the only funding available from government and TfL was emergency funding for emergency measures. So we were not able to undertake that engagement and consultation beforehand that we would usually do as a local authority, apart from with the emergency services and key stakeholders such as the refuse services. Now, I know this is difficult for people because it's not how we usually work, and residents were already feeling fearful with the pandemic and the seismic changes in how we were functioning as a society. And another change is difficult to handle sometimes. So we have been listening to feedback, and we are adapting and tweaking and currently consulting. So we've used planters as modal filters, leaving gaps and no bollards. We've removed metal barriers which prevented adapted cycles, cargo bikes, etc. from getting through passageways. And for example, there in the photo on the right, you can see Summer Leighton Passage in Brixton and the very lovely Isabel Clement posing there. In some places, we've put in dropped curbs to ensure that our LTNs are as accessible as possible for all types of adapted cycles, wheelchairs and mobility aids. The aim is to have our routes connected, LTNs connected to local parks. And in that bottom picture, you'll see there's a drop curb that enables people to come from Brockwell Park over our amazing Rainbow Pride crossing through the shared space at Herne Hill Station and onto Railton Road low traffic neighbourhood. But now we need to look to the future to ensure that any of our future public realm works, including if we make any of these LTNs permanent, are fully inclusive. We need to undertake street audits and continue to work with colleagues across our community who have the experience and the expertise to know what works and what doesn't, and where the less obvious barriers are. And we know we need to do so much more. Financially, it's not easy. We have faced 10 years of austerity and now have a COVID funding gap. Robert Jenrick and Boris Johnson said at the beginning of this pandemic, "Let money be no object. Do what you have to do, local authorities." So we all did. But the government, I'm afraid, is not putting their money where their mouth was. So on top of 10 years of austerity, we now have on top of that a huge COVID funding gap, which is huge across local authorities. And with this new lockdown and needing to support residents and businesses, I fear it will get worse. But for me, the issue is this. If we do not remember our core values of equity, equality on our streets, and accessibility for all, we can't even begin to understand and discuss what is needed, and so cannot begin to address it. And we need that dialogue and we need that ambition so that we as local authorities, we as stakeholders, partnerships, residents groups, businesses and individuals, we can have a truly meaningful dialogue on what our priorities are, where the scant money but ample and rich expertise we have can be deployed, where and how we can then as local authorities, as communities, collaborations and partnerships deploy those expertise and make the most equitable bang for our buck. Because for us in Lambeth, the way we do things is inextricably linked to what we are trying to achieve and why we're doing it. So inclusive and accessible streets and an equal transport system are not add-ons or options, but I'll say are fundamental to creating a safer, cleaner and fairer Lambeth for everyone. And Thomas, I think I'll leave it there. I don't think I have another slide.
Brilliant. Thank you very much, Councillor Holland, for providing such a thorough overview of some of the inclusive and accessible interventions implemented within the London Borough of Lambeth. We'll just have, we've got some time actually for a Q&A session. So audience, please do feel free to ask your questions into the chat. Any questions for Councillor Holland? To open up the discussion then, Councillor Holland, looking at the work that you and the borough have done that has happened within the London Borough of Lambeth, and the lessons that you have learned from doing this work, what key pieces of advice would you give to other boroughs or local authorities who are looking to improve accessibility on their active travel and other transport networks? What would be your key learning?
I think the key learning is that we can act more quickly as local authorities than we previously thought we could. We can be agile and responsive. Of course, along with that, there is an increase in risks that you get things wrong or there are unintended consequences. So as well as acting quickly and being agile, I think we have to continue to ensure that we are speaking to key stakeholders, to right people, to groups of people who have disabilities, who experience the challenges and the barriers in our street and in our transport system, to ensure that we keep getting it right, and that when we get it wrong, that we're not afraid to say we get it wrong, and that we revise it and that we adapt it. And I think the other key learning that I have is when you do things in an emergency, it's as I said before, because we didn't do how we usually did it, which is this long consultation in advance and then looking at designs and then maybe implementing. We're now having to have that conversation with things in situ. And so we're having to now have that conversation where we're bringing communities with us. We have some people with us, but other people are finding change difficult. So I think for me, the key thing would be to continue that dialogue, continue to listen, try and understand what people's concerns are. And sometimes solutions are straightforward and simple, and sometimes they're not so straightforward and simple. I think the thing is to understand that we can actually, by collaborating and working together, achieve a lot more and a lot more quickly than we previously thought we could.
Absolutely. Thank you very much, Councillor Holland. We have actually had a question from the audience from Ian Marshall, and Ian's asking, what is your definition of a healthy route?
Okay, this is where I need an officer here, obviously, to be more techie than me. How I would describe as a healthy route is a certain number of vehicles per hour on a road. So, for example, I believe that a standard measurement is if there are 200 vehicles or more per hour at peak hour, then that's not acceptable on a healthy route. And so what we did with our transport strategy is we looked at the borough as a whole and looked at where those healthy routes were and where we wanted them to be, where we wanted to create a healthy route. So it would not be one of the main roads, it would be a quieter road, but it could still be very busy. As we know, in London, we have traffic everywhere. And we looked at designing those routes, those healthy routes, so that they could link up, and that if they had too much traffic on it, how do we reduce the traffic? How do we create safer spaces for walking and cycling, so that the traffic doesn't just get displaced elsewhere? And we also divided the whole borough into cells that were smaller than our traditional wards. And we looked at a series of factors and we rated those cells according to priority about how much traffic was in them, whether there were schools and GP surgeries in them, health centres, etc. And we tried to connect that up with our healthy route strategy. So in terms of a healthy route, I would say it's one where you don't go over that threshold of the number of vehicles that are passing in it. But, you know, there are other issues around a healthy route as well, whether, and in terms of talk that we're having today, in terms of, is it healthy for everybody? You know, is it accessible for everybody? But I think in the industry, when people talk about healthy routes, that's what they mean, that it's healthier to go along. But I just think we need to expand that definition, and we need to talk far more generally about it and make sure that we are including the barriers around disability and for other groups in society.
Brilliant. Thank you very much, Councillor Holland. How are you working then with your neighbouring boroughs to ensure continuity regarding accessibility for all across maybe your transboundary transport networks?
Yeah, so across London councils, we have a Transport and Environment Committee where transport leads meet regularly and we stay in touch regularly. And it's a really great group of people who are looking to work far more collaboratively together. And then immediately with our own neighbours, for example, during lockdown, when we had to do pavement widening on a temporary basis, we worked very closely with Southwark around the pavement widening in Herne Hill under the bridge there. And I do meet with my colleagues in neighbouring authorities. You know, I've met with Westminster, I've met with Southwark, and we do that in order to ensure that where there's projects that we have to collaborate on, that they are consistent with each other, that we're not undermining each other, and that, you know, we can produce a much better product basically, and a much better system if we're working together on it. I think there's always room to work more closely though, and we border a lot of boroughs. We have very good relationships with Merton as well and Croydon. And so, yeah, I think it's a really good question because we need to work in closer collaboration. And I think we could do it more and we could work much more smartly together. But I'm pleased to say that when we do approach each other, it's a very open and inviting relationship. And I think it's one that could get stronger and stronger.
Brilliant to hear. So yes, collaboration is key. I think we've got time for just one more question, Councillor Holland. And your presentation mentioned a lack of funding for many of these accessibility improvements. How do you plan to overcome this issue? And what did you do as part of your emergency measures over the last few months to help incorporate accessibility for all?
Well, we're going to continue to lobby for more funding. I think that's key. One of the things that we'd never experienced before was this funding being tied to emergency measures. And as we move forward and as we want to do the adaptations and changes that we were talking about and removing the barriers, then we do need to access funding to do that. I believe there's rumours that there's going to be more funding from the department for transport, but I don't know what that looks like yet. I think we were talking about partnerships. I think that we need to form closer partnerships and collaborate more, so we're not replicating each other, so we're not wasting money, but we're working smarter. And I think with the resources we have to prioritise them. We have to work out, how do we really want to spend this money? And that will be quite a difficult conversation with the community because not everybody will agree on it. And that's where we come back to our equalities agenda and looking at what are we doing this for and why. And as a council, we have committed capital in our capital investment programme to transport, highways and environment measures and around tackling transport inequality, around tackling the climate crisis, and we're trying to work much more smartly so that we get much more value for our money. So it's not a great picture going forward, but there's still stuff that we can do, and we need to continue to do it, and we need to continue to lobby for that money, because, as I said, I genuinely don't believe that we can tackle inequality without having equality on our streets and in our transport system. It's fundamental. It's fundamental to us as a city. It's fundamental to us as a borough. And it's fundamental to us as individuals and communities.
Absolutely. Thank you very much, Councillor Holland. We are going to move on, but I can see that we do have a quick question from Abdul Najid. I'm wondering, Councillor Holland, if you'd be happy to maybe just provide a quick answer for Abdul in the chat. If you'd be happy to do that, that would be brilliant. But thank you very much, Councillor Holland, for your talk and for the Q&A session. It's really appreciated.
Thank you.
What we will now do is we'll move across to Tamara Juretic and Vinakayi Niambayo from the London Association of Directors of Public Health. Both Tamara and Vinakayi will be talking more about the impact of COVID-19 on air quality and our health. Over to you both.
Thank you very much, Thomas, and thanks for inviting us. And good afternoon, everyone. So this is going to be a bit of a double act. I'll start off, and Vinakayi will follow. So I'm Tamara Juretic. I'm Director of Public Health, and in the Borough of Barnet. But I also represent Directors of Public Health Association. So just very briefly, who we are and how do we do our business, I suppose. There's about 130, 140, sorry, just a second. Sip of water. 130, 140 Directors of Public Health across the country. And they come together into the Association of Directors of Public Health nationally. And we also have regional networks. And one of the regional networks is London. So what we do every year, we set up a number of priorities. And certainly this year, because of COVID, the amount of time and effort we put into other priorities have been reduced. But one of the priorities that always has been part of our portfolio is reducing the air pollution and improving air quality across London. And my role is to lead across London in terms of champion this agenda and link with other partners across the system to progress what we can be progressed across London, but also to influence what we do at each local authority level. We also work very, very closely with London Environmental Directors Network, and we have published a joint position statement in 2019, and Vinakayi and colleagues have just looked into this through COVID prism, and we have just been updating this and are hoping to reissue very, very shortly. Right. Okay. So, air quality issue certainly has been brought to forth with COVID-19 pandemic, and it's been a devastating pandemic. But in some ways, it has at some point improved air quality, but it also has introduced some behavioral change in a much faster way than usually. But air quality is something that across London Mayor has been championing for some time now, and as a result of that, we can actually see that there's been a huge improvement in reduction of specifically nitrogen dioxide and across the city. But it is important, as mentioned previously, to understand that there are still huge inequalities in air quality and air pollution across London and across the country. So the number of Londoners living in area exceeding the legal limit for NO2 have reduced by 94% actually, from over 2 million in 2016 to only 119,000 in 2019. So that's a really good measure and really positive indication that things have been moving in the right direction. Under the same thing, the number of state primary schools and secondary schools in the areas of NO2 are also reduced by 97%. But in 2016, the whole London exceeded the World Health Organization guidelines limit for particulate matter 2.5. There is also lots of evidence to suggest a different relationship between air quality and other health issues. So we know that air pollution does worsen the asthma attacks and make it much more severe. We also know that that there is a link between pollution and brain function, and some new research is also suggesting that there is a link between air pollution and dementia. However, we need to understand this much closer. Because air pollution is usually higher in a more deprived area, and this is where sometimes there's a high proportion of people from Black and Asian ethnic minority groups. We do see that the ethnicity is actually strongly correlated with pollution exposure. So this is just to demonstrate what's been happening during the pandemic, and what you see in these three diagrams. You see the decrease in NO2 across the UK. So it's a good news in terms of looking at that. However, when you look at the evidence during the pandemic, it is not necessarily conclusive. So we do know that NO2 has gone down, but particulate matters have actually increased in 2020 after the lockdown. And we also know that ozone concentration were higher post-lockdown. There are different hypotheses why that is the case, but we do know that during the COVID pandemic, a number of people have actually stayed at home, and working from home does increase potentially heating and use of gas, which would have a different, if you like, impact on the air pollution. So now I'll hand over to Venekai to continue with a few more slides.
Hi, Venekai. I'm just wondering whether you're having trouble unmuting yourself at all. We still can't hear you, Venekai. I'm wondering, it might work if you log back in and use the link to come back into the session. I'm wondering, Tamara, would you be able to kindly fill in for now, and then when Venekai is back, we can hand back over. Is that okay?
Of course, yes. Not as
hello. You able to hear me now?
Good.
Yeah.
Fantastic. Apologies. I'll start again. And I'm conscious that we've only got a few minutes left, so we'll briefly go through the last few slides here. So just to introduce myself, my name is Venekai Nambayo. I'm the Partnerships and Improvement Lead at ADPH London. I support Tamara, who is the Director Public Health Lead for Air Quality, as part of that public health agenda and bringing that voice across London and advocating for improved air quality in London. So I'm just going to briefly illustrate on this slide here the health perspective. So looking at one side on the impact of the national lockdown, the first lockdown, which we had gone through for approximately 3 months, and how people who have lung conditions responded to that in terms of their symptoms. And then I'll briefly talk about the link between air pollution and COVID-19 mortality, if indeed this is a risk factor. So as you can see on the left-hand side, there was a headline that came through around May from the British Lung Foundation, where they had put together a survey which they had sent to 14,000 plus people who have lung conditions, variations of lung conditions. And they asked various questions, which included if they had seen difference in air quality during the lockdown from their perspective, and also if they had experienced any improvements with their symptoms, any changes with it. So this statement came through of nearly 2 million people with lung conditions noticed improved symptoms as a result of drop in air pollution. 2 million, you would think, how did they get that number? So from that survey, where 14,000 took part in that survey, they estimated that of those that had responded to that survey, 1 in 6 had said that they had noticed an improvement in their symptoms from their lung conditions. So then that's how they estimated or equated it to a 12 million proportion of those in the UK that have lung conditions. Approximately 2 million of those would have seen an improvement in their symptoms. So this is great to see that there seemed to be an impact from that. And when we looked at figures from a London perspective, contacting British Lung Foundation, there were just over 1,000 respondents from London that took part in this survey. And in fact, the significant decrease in air pollution was cited by 34% of those that had responded in London. And then when you look further down in terms of breakdown of figures of the impact of their symptoms, of 735 Londoners that responded in this survey, 30% noticed a significant improvement. So focusing on if air pollution is a risk factor for COVID mortality, this is a question that is still ongoing, where there's a lot of research that is going on. You may have seen from the air pollution news and from newspapers like The Guardian, for example, where there have been studies that have come through from China, from the US, Northern Italy, the Netherlands, particularly during the first lockdown, and the impact where they were looking at the association between long-term exposure to air pollution and with severe symptoms and looking at COVID deaths. In August, the Office for National Statistics, they looked at those studies, and I believe that there's still studies coming through, some to be peer reviewed. But when they did their statistical analysis, it was found that the effects in which it had been reported in previous studies, when they looked at the statistical analysis from their side, they felt that there was a smaller than reported sort of number of COVID deaths when you're looking at long-term exposure to air pollution. And the reason why that they looked at that when they looked at that statistical modelling was because of other factors that may come into play. So looking at deprivation, population density, looking at pre-existing conditions, comorbidities. As Tamara mentions in the previous slides in health inequalities, you have those from minority ethnic communities living in predominantly polluted areas, highly populated, dense areas, pockets of deprivation. So these are the factors that may be influencing the mortality. Indeed, air pollution may be a contributory factor, but we still can't say for sure that it is a definite risk factor of COVID mortality, and this is something that is still being studied. So I won't talk too much about the sort of the initiatives around how it is that we're trying to improve air quality, reduce air pollution around active travel, cycling for everyone, because I anticipate that there will be more spoken about it with our speakers around that. But I just wanted to sort of mention briefly the benefits of active travel, a decrease in nitrogen dioxide, particulate matter and carbon dioxide, which helps with the atmospheric improvement on air quality. We see these as benefits in terms of physical activity, improvements in physical and well-being, mental health and well-being as well, and how that contributes towards economic performance in reducing congestion. A Sustrans paper was released in July 2020, which highlighted that there are groups, demographic groups, that have never taken cycling. So as you can see, the stats of those who are aged over 65, 85%, 78% of disabled people, 76% of women, 75% at risk of deprivation, or people from ethnic minorities. And these may be barriers due to, costs, I guess thinking about cultural norms, space, thinking about access, and an environment to encourage cycling and walking. And already we're seeing with the initiative of Street Space that is being promoted. There are a couple of examples here from London Bike Kitchen, where it's a DIY workshop in London, where they encourage people to bring their own bikes to do DIY, but they also run women and gender variant nights, and also a women of colour group to encourage inclusive cycling. And then at the bottom, you can see a screenshot of Bike Works, which is an interest group, a community interest group in East London, where they run all ability cycle clubs. So again, that inclusive approach of bringing those age, disability, whatever experiences. Finally, just touching briefly on the low traffic neighbourhoods, because I know that this has been comprehensively covered by Councillor Claire Holland from Lambeth, and their experiences of introducing this initiative in London, which of course came from the emergency active travel funding, which was released in May. As you can see, there have been some headlines that have been associated in terms of how it has impacted on accessibility, particularly for the disabled and for other vulnerable groups. And we have heard concerns around, from the start, traffic surge, in terms of longer car journeys. But the key things that have come through in terms of learning, and something that already Councillor Claire has touched on, was around the importance of public consultation engagement where possible. And this was an initiative that was quickly initiated, it was quickly put forward, and it would have been more desirable to have more time to really engage from the beginning with the public, to get that buy-in, to really get that understanding of what areas would work in terms of initiating the LTNs, where there could be potential barriers, and also bringing in that equality impact assessment and communicating the benefits with the community in terms of how it can help to reduce traffic, it can widen space for people to be able to walk, to be able to cycle as well. I've put a link here which goes to the study that was produced following Waltham Forest prior to COVID, when they had piloted the low traffic neighbourhoods, and it did show real benefits. And I guess from that intelligence, and also trying to understand from a local perspective how to try and put in pilots or temporary initiatives to see how things work. Already we're hearing from local authorities that they are continually engaging with the community to see how best to really support in terms of putting in these local traffic neighbourhoods that work for the neighbourhood, and also help to promote active travel and to improve air quality. So I'll leave it there. Yeah, if you've got any questions.
Brilliant. Thank you very much, Vinakai and Tamara, for providing such a great talk there. So I can see that we don't have any questions from the chat, but if you do have any questions, please do post them in there now. We are slightly tight on time, Tamara, Vinakai, but what I will ask one very quick question for you, just to kind of get your perspective on this. So with the increase in people travelling by active travel means, and also private car use, as a result of less people using public transport, does this pose an elevated risk of more severe COVID-19 symptoms due to increased exposure to poor air quality?
Thanks, Thomas. Vinakai briefly covered this in her talk. So what is happening at the moment? There is an inconclusive evidence, really, as to what are the links, direct links between poor air quality and COVID. What we do know is it does look like on the population level, when you look at it, there's been an decrease in air pollution, but increase in number of deaths during the lockdown. So looking at that, you can't kind of make direct links. But when you look at some of the studies, you look at biological plausibility, you do see that some of the air pollution particulates can carry parts of the virus, though. But there is something about impact on air pollution on underlying conditions that make the COVID more severe. And then there are very established links between cardiovascular disease and severity of any other breathing problems and air pollution. So therefore, really, it is important to focus on increasing air quality, regardless of research study, if you like, because we know that if there isn't direct, there is definitely indirect association.
Absolutely. Well, thank you very much, Tamara, and thank you very much, Fenikaia. I'm not sure whether you've got anything to add to that at all.
No, nothing to add, really. That was perfect. Thank you, Tamara. Brilliant.
Thank you very much, Fenikaia and Tamara, for such a great talk. We'll now swiftly move on, though, to both Isabel Clement, Director at Wheels for Wellbeing, and also Fiona Cool, Healthy Streets Everyday Project Manager here at Cross River Partnership. And they'll both be talking about mobility justice and transport inclusivity. So over to you both.
Brilliant, thanks Thomas. So as Thomas said, I'm Project Manager here at CRP, and I'm being joined by Isabel Clement today, the Director of Wheels for Wellbeing, to discuss the topic of mobility justice. So what is mobility justice? Well, broadly speaking, it's the principle that all people should have the same opportunity to move around and access a space or place, regardless of their physical ability, race, sexuality, or any other characteristic. To quote Mimi Scheller, mobility justice is one of the crucial political and ethical issues of our day, when the entire world faces the urgent question of how to make the transition to more environmentally sustainable and socially just mobilities. So in order to transition to environmentally sustainable and socially just mobilities, there is a discernible need to improve inclusion and access to transport. For example, transport can be one of the principal barriers faced by persons with impaired mobilities, yet as DfT's inclusive transport strategy states, inclusive transport and travel planning has the ability to open doors, to unlock potential, and to increase confidence. It enables people to see family and friends, as well as seek and access employment. It can make the difference between feeling socially isolated and feeling socially included. So to emphasise this, I've included some stats that you can see on screen, and I think the one that really stood out for me was the recent poll by the UK government that found in July 2020, during the pandemic, 42% of disabled people said that they were feeling lonely and spend too much time alone, whilst 25% surveyed said that they felt like a burden on others. So what is being done to achieve mobility justice? Well, the Healthy Streets approach is a global policy framework developed by public health and urban transport specialist Lucy Saunders. It aims to create streets that are welcoming places for everyone and that are designed to deliver a healthier, more inclusive experience. To quote the Healthy Streets website, the best test for whether we are getting our streets right is whether the whole community, particularly children, older people, and disabled people, are enjoying using this space. So underpinning the Healthy Streets approach are 10 Healthy Street indicators that are crucial to healthy streets. These are shown on the screen. The Healthy Streets approach aims to improve the accessibility of streets by using these indicators. This might include removing obstacles, widening pavements for wheelchair access, raising sections of roadway to make crossing easier, and ensuring on-street cycling facilities that cater for a range of cycles used by disabled people. So Cross River Partnership's Healthy Streets Everyday programme is a 3-year cross-sector project that is funded by the Mayor's Air Quality Fund. It aims to empower boroughs, businesses and communities across London to deliver pedestrian priority healthy streets that are accessible to everyone. This includes increasing walking rates and reducing emissions and exposure to toxic air. It's also helping to supplement London's COVID response by creating streets that can accommodate and encourage increases in sustainable and active travel. However, another key element of the programme is to provide guidance and support. In order to make our transport and mobilities more inclusive, it is important to understand the challenges experienced by those that face mobility injustice. I'm therefore extremely pleased to announce that Cross River Partnership's Healthy Streets Everyday is going to be producing a mobility justice guidance. It explores 5 stories of mobility injustice faced by individuals with a mobility impairment. By providing a voice to the everyday experiences of these individuals, we hope to support local authorities in their ongoing thoughts about the considerations that are needed to make transport and mobility truly accessible, as well as raise awareness to the day-to-day conveniences that many able-bodied people may take for granted. So it now gives me great pleasure to introduce Isabel Clement, the Director of Wheels for Wellbeing. Isabel was one of the individuals who was kind enough to talk to us to inform our guidance document, and we felt it would be really good to discuss some of the topics that came up in the guidance as part of this live share. So firstly, Isabel, would you like to introduce yourself and tell us a little bit more about what's being done by Wheels for Wellbeing?
Sure. Thank you very much for having me on this chat. So yes, I'm Isabel Clement. I'm the Director of Wheels for Wellbeing. So a little bit about myself. I'm in my mid-50s. I'm originally from France. I've been in this country since the late 80s. And I've been a disabled person pretty much all my life, and other than the first 10 months of my life. So I'll take that as my whole life. And my mobility has evolved over those 50 plus years. And I've always been a mobility impaired person, if I want to label myself. And as I say, my mobility has evolved, and therefore I have had to evolve in my own head as to what is mobility and how do I make sure that I can keep moving. My work is with Wheels for Wellbeing, which is a small charity based in Brixton in South London, in the lovely Lambeth area that Councillor Holland talked about earlier. And Wheels for Wellbeing, we do two things. We are a provider of cycling opportunities for disabled people in South London, at 3 different places. One in Southwark, one in Lewisham, and one in Croydon, where we make cycling solutions available to disabled people who can come and use them when we're making them available. That's to ensure that disabled people can realise they can cycle. They have the opportunity to try it and to practice it. That's where we started. That's all we used to do and kept us busy for many years. But then the last few years, we have actually become also an advocacy and policy influencing organisation, realising that the whole world out there until then didn't really understand that disabled people do cycle, and therefore in the planning of cycling and provision for cycling, disabled people were not being taken into account, and the barriers to cycling experienced by disabled people were just continuing to exist. So we took on the mantle, and we decided to become the voice of disabled people who cycle.
Brilliant. Great. Well, I guess the next sort of thing, when we had our interview to inform our guidance document, one of the things that you said was the main reason you find that disabled people drive everywhere is the woeful quality of pavements. So I thought it'd be really interesting if you could expand on that.
Sure. So as you can see on the picture, I'm a cyclist, I'm a hand cyclist, and I run an organisation which is all about cycling. So why do I talk about pavements? Well, pavements are where every journey starts. That's a bit of stating the obvious. But therefore, for disabled people, often the quality of the pavement is such that for a lot of disabled people, walking, wheeling, pushing, scooting on the pavement is simply not possible. That, as a result, is leading people to rely on either themselves, driving themselves around if they have the opportunity to, and not many disabled people do drive, but also therefore being reliant on other people picking them up, and that totally takes away your independence, even though obviously it might enable you to move, but you are dependent on other people doing that for you. What we need to be thinking about before we think about cycling or walking for disabled people is how accessible are our pavements? And I can tell you from experience and from hearing it from many other people, pavements are currently in the UK terribly inaccessible, and in London in particular, and in central London all the more so. So that's because they're often too narrow, though width may not be, the pavement itself might not be narrow, but it's narrowed down by what we call street clutter, bins, A-boards, tables and chairs, all the more so at the moment since COVID. etc., etc. Electric car charging points, you name it. They are narrowing the pavement. Pavements are broken up. There are tree roots poking out of them, etc., etc. Which might, for some people, well, a lot of people, they might just be a bit of an inconvenience. For a lot of disabled people, they just stop them from being able to consider walking out of door, wheeling out of their door. So that I'm becoming much more sort of focused on pavements, because I've realised that actually we won't get people travelling actively, let alone thinking about cycling, until we've solved the problem of inaccessible pavements. And just to add another point, which I didn't mention, a huge issue is about camber and changes of levels. Driveways cause all sorts of problem, and it creates an extreme level of stress and discomfort for people.
Yeah, no, thank you for sharing that. And I guess talking about active travel then, one of the things you mentioned was that some of the streetscape changes have actually enabled you to grow your confidence to cycle more. So can you explain firstly what sort of streetscape changes you're referring to, and how and why they've helped you to grow your cycling confidence?
Absolutely. Streetscapes changes, well, as Councillor Claire Holland mentioned, in my borough in Lambeth, I live there as well as work there, we have had a lot of low traffic neighbourhood interventions. And as a car driver, my goodness, my heart bleeds, because as I was showing physically to Claire Holland yesterday as we shared a ride, my lovely rat runs have all been cut off, and that could be a terrible thing, except that I am equipped and I am able to cycle, and therefore actually it's created the extra little nudge that I needed to actually get me cycling a lot more. Less traffic means less stress for cyclists. I mean, I don't think you can put it any more simply. Traffic, noise, traffic, just cars, buses, and lorries are not something which is comfortable to be sharing roads with. So less stress means you've got more time to enjoy what you're doing cycling. You've got more time to think about where you're going and potentially look for your way without worrying about being in the way of drivers if there aren't any on that street. And also for me as a three-wheel a hand cyclist on three wheels, I find camber extremely dangerous. It creates, again, it's a stress creator, and streets tend to be cambered into varying levels. And if there is, I like to, it's much more convenient and safe for me to cycle in the middle of the road. So of course, if there's a lot of traffic, that is a little bit tricky. So low traffic neighbourhoods for me as a cyclist have been really helpful to encourage me to cycle more. I've been therefore cycling further and growing my fitness and my confidence.
Brilliant. That's well, it's always good news that the low traffic neighbourhoods have been providing you with that. So brilliant. I guess, Thomas, do we have? We probably need to finish there, I guess. But thank you so much for talking to us, Isabel. And basically, if you want to hear about more of Isabel's views, along with some of the other people that we've spoken to as part of our mobility justice guidance, do keep a lookout over the coming weeks at CRP's newsletter, because we will be publishing this very shortly. So thank you so much, Isabel.
You're welcome.
That was brilliant. Thank you very much, Isabel and Fiona. Yes, so we will move on just to our final observation point for the session, the last 2 minutes. So we've had some extremely insightful presentations today, and thank you to all our speakers for those. And I hope they've, well, all of you's viewers have found them useful, and that they've provided you with some further insight into how we can ensure inclusivity for all as we begin to build back better. So with the last about a minute and a half, I'd just like to pose a question for our speakers, and that question being, what final piece of advice would you give to policymakers in local and central government to help build back better, particularly within the realms of street-based design, accessibility, and improving air quality? So let's go in reverse order of those who spoke. About 15 to 20 seconds each. I know it's a challenge. Let's firstly start with you, Fiona.
So my advice would be not to underestimate the importance of keeping people informed and providing information. Ultimately, although we need to make changes in the public realm as accessible as possible, they will inevitably not always be perfect for absolutely everyone. So helping people to understand why changes have been made and the associated impacts, I think, is very, very important.
Brilliant. Many thanks, Fiona. And across to you, Isabel.
So for me, really, my plea would be engage with local disability organisations. If you have one, you probably will have one. Other than that, with local disabled people who live in your areas where you're going to make interventions. And also, I will make a plea for engagement with experts in the field, people who've been thinking about accessibility and the public realm and transport. So, of course, Wheels for Wellbeing, but also Transport for All and which is another disabled people's organisation in London. Thank you.
Absolutely. Thank you, Isabel. Across to you, Vinakai.
I would say throughout this conversation and from the COVID pandemic, one thing that has definitely come through and has risen to the agenda is health inequalities. So I would absolutely say to politicians, this is an opportunity to really change and improve health inequalities in a different way, in a much more holistic way. And thinking about inclusive active travel is definitely a benefit and something that I think we're beginning to become a lot more aware of, particularly during the pandemic.
Brilliant. Thank you, Vinakai. And across to you, Tamara.
So what is also being apparent is that all of the changes and making accessible travel do require certainly behavioural change, but also require resources. So in our joint statement with environmental directors, what we are asking nationally and advocating for is at least 2.5% of annual UK GDP to be put against air quality and climate change.
Brilliant. Thank you, Tamara. And finally, across to you, Councillor Holland.
Yeah, thank you. It's quite hard to top all those. I agree with everything that everyone said. I would say that we need to be as well brave and bold. And we need to involve people in the conversation who might not ordinarily be involved. And finally, I'd say in Lambeth, we believe in theft. We love to steal people's ideas. We don't borrow them. As long as we acknowledge who we're stealing from, I think that's fair enough. So we don't all have to go away and reinvent the wheel, but we need to just work collaboratively, share ideas, and that way we can innovate and basically create inclusivity for all.
Absolutely. Thank you very much, Councillor Holland. Well, brilliant. Great comments there from everyone. Thank you very much. So finally then, before you all leave to go about the rest of your afternoons, I would just like to remind you all to sign up to our newsletter and follow us on Twitter and LinkedIn to receive all of our latest updates here at Crossroad Partnership and our upcoming LiveShare sessions. A registration link for our next event will also be publicised via these platforms, so do keep an eye out. This LiveShare, past LiveShares and all of our future LiveShares will be posted on our YouTube channel for you to view whenever you want and also to share with whoever you want. Any questions you have, as always, please do get in contact with any one of us. Our contact details are on your screens now. And well, I'd like to thank all of our speakers today for some really thought-provoking and insightful presentations. And a big thank you to everyone for tuning in and joining us this afternoon. Remember to stay safe and see you all again very soon. Goodbye.